Good afternoon, everyone, and welcome to Real Talk COVID-19 webinar. We're here to talk about what you want to know about COVID-19. I'm Dr. Scanterbury. I'm a retired transplant surgeon, and we're here with several of our faith leaders in our community to discuss COVID-19, to talk about why you should get vaccinated, to answer your questions. So please feel free, wherever you are, to ask questions. You can put them into social media and they'll get to us. I want you to know that we are watching. Invite your friends and your family to help spread this message. So here today with us, we have several guests, our pastors, and they will introduce themselves and tell you a little about their background. So first we'll have Pastor Rainier Robinson. Pastor.
Thank you, Dr. Scanterbury, and thank you to the United Way of Delaware for all the wonderful work that you are doing, especially around COVID-19 and encouraging communities to be vaccinated. I am the pastor of Bethel AME Church in Smyrna, Delaware. I call it the thriving metropolis of Smyrna, and my interest is in health equity and equality and addressing the social determinants of health in communities of color. Thank you again for having me today.
Thank you. Reverend Page.
I am Reverend Rita Mishu Page. I'm the pastor of New Beginnings Community AME Church in Frederica, Delaware. And I too would like to thank United Way and Dr. Velma Scanterbury for the honor of being a panelist this evening. And I serve as the Kent County Coalition Chair for Vaccines for the Black and Brown Community.
Thank you so much. Reverend Waters.
Yes, good evening. I'm Reverend Claude Waters, and I pastor St. Paul in Milford and Wesley Chapel in Slaughter Neck, and I'm here as an advocate for justice as well as the on-site registration for those who are shut in at home and can't get to a computer to register. So that has been part of my job, working with First State Community Action in getting the community registered and on-site for vaccines.
Thank you so much. Reverend Griffin.
Yes, good afternoon. I'm Reverend Dania Griffin. I'm pastor of Antioch in Frankfurt. I too want to thank you, Reverend Scanterbury and the United Way for giving us the opportunity to share our experiences. I find myself lately being involved in testing, getting folks tested through the curative effort, as well as working with First State Community Action and Baby Hospital with doing the mobile vaccine. And I find myself getting more and more involved. And I think it's important that we speak with one voice, that this is a must for all of our communities, that we get vaccinated and we keep getting tested as well.
Thank you so much. Pastor Beeman.
Yes, I'm Reverend Sylvester Beeman, pastor of Bethel AME Church. Dr. Scanterbury, thank you, and the United Way, thank you. Part of my ministry from the very beginning, and I guess it probably goes back to my childhood, as I was part of a church that was committed to the whole person and the whole community. And so as the pastor of Bethel, I've been trying to do that with our HIV/AIDS ministry, our health and wellness ministry. And of course, when COVID hit, we got into the trenches immediately to try to make a difference. And so I'm here because I want to make a difference, and I'll talk about something else later.
Thank you so much. Pastor Livingston.
Yes, my name is Reverend Lawrence Livingston, and I am the Senior Pastor Emeritus of the Mother African Union Church in Wilmington. And I want to just thank United Way and Dr. Scantlebury for this opportunity to be on this panel. I'm certainly interested in the way this pandemic has disproportionately affected African Americans and disproportionately affected Black and Brown people, not only around the nation, but in our community. I have always been a person who really kind of stands for the justice and righteousness of God as it affects African American communities. And so I'm really interested in getting the word out and making sure that our people get vaccinated.
Thank you so much. I appreciate each and every one of you being here this afternoon. And before we get started, let me thank our partners who allowed this webinar to take place. And so we are here because of Trinity Health, Mid-Atlantic, St. Francis Healthcare, the Modern Maturity Center Incorporated, Interdenominational Ministerial Alliance, H&S Impact Group, Community Interventional Team, National Coalition of 100 Black Women of Delaware, First State Community Action Agency, Wilmington Community Advisory Council, Delaware Racial Justice Collaborative, and United Way of Delaware. So I thank each and every one of these for partnering with us this afternoon so we can have this real talk. And so before we get started, I just want to make everyone be aware of the fact that so far in Delaware, there have been over 680,000 people who have been vaccinated. But unfortunately, there are still people dying from COVID-19. And it's very important that we get vaccinated. And I understand that some of us are reluctant and have that fear. And I have to admit that in the beginning, I didn't want this vaccine. I didn't trust the system. I didn't trust the government. But I also saw people dying all around me. And so I had to make a choice. Do I want to live, or do I want to succumb to this COVID-19 pandemic crisis? And so I'm going to ask each and every one of our panelists here this afternoon, tell us, why did you get your COVID-19 vaccine? What led you to make that decision? And I'll start first with Pastor Robinson, Reverend Robinson.
Thank you. When COVID-19 started, I recall being on a call with my fellow colleagues in the Wilmington district. And as we were talking about COVID and our concerns, I admitted that I was scared. I wasn't frightened, but I was scared. I had seen what COVID had done, the sickness that it brought on to many people. And immediately I knew that I was one who most likely or could probably get COVID because I am on the spectrum of, I'm a Black male, I have a history of heart issues, and I knew that when America gets a cold, people who are Black and brown like me, we get the flu. And so I was really scared. And so as I saw the numbers continually going up in Delaware, I took all the precautions, wearing the mask, the social distancing, not going to the grocery store. And so when the vaccine came along, that was promise to me. That was protection to me. And so I decided to protect myself, alleviate some of my fears, and to protect others. I saw this as a way of being able to once again spend time with my 80-year-old mother on Sunday afternoons at dinner. I saw this as a way of being able to resume some level of normalcy. And so, me getting the vaccine was very important, not only to myself, but it was important as I took precautions and as I took care of those who I cared about. So that is why I decided to be vaccinated. Church was also of great importance. As a pastor, I knew that what I did had influence on the congregation that I led. And I'd always preached a ministry that I cared not only about your spiritual life, your emotional life, but also your physical health. And so I saw this as a way of sending a message. Thank you.
Thank you so much. And Reverend Page, we've been on several COVID-19 panels
Yes.
and conversations. So tell us again why you got vaccinated.
Well, there was several reasons when COVID first hit. I called my family together on the Michoud side of my family and said we need to start having family prayer through Zoom. And so once a week we do that and learn, that I have many family members who were either in the hospital or who had passed away from COVID. Then not only that, but I had members in my church who got very ill from COVID. None of them passed away, thank God, but got very ill, down to a 4-year-old child. And the more I got on, I was appointed to the vaccine sub-communications committee for the state, and I started not to serve on that committee. And it was my sister, Dr. Wilma Michoud, and Reverend Robinson's wife, who convinced me to stay on the committee because I too was not in favor of the vaccine in the beginning, because we are hearing former President Trump talk about putting detergent and so forth in the vaccine and talking about a chip. So I had told Andrea Wojcik, I can't serve on this committee because they wanted us to promote the vaccine in the Black and Brown community. I said, I can't serve on this if I don't believe in it. But then I decided to get on a Zoom and see what it was all about. And I started learning about the vaccine, the significance of it, why we needed it. And this was before we started the Zoom sessions, Dr. Scantlebury, and started learning what was in the vaccine. And then I'm a chaplain at the hospital, and the deaths were just increasing and increasing. And then learning about being overweight and having diabetes, and I fit that category. And your risk for death was very high. So to lead by example for my congregation and for the community, I finally decided to get the vaccine. And for someone who did not believe in it for quite some time, so here I am now chairing the committee and really out promoting it. And so then I thought about polio and how it was eradicated through vaccine. And I believe that this is the way that we're going to eliminate this COVID-19 as well. And so for the protection, of my family, and to be protected, to protect others from me and me from them, like I said, and to be an example for the community, to let people know that it's all right to get this vaccine and we need this vaccine. I went on and got my vaccine because I think it's the right thing to do.
Thank you so much. And we know
Mm-hmm.
that trust is an issue. That trust, as far as being a Black and Brown person, and so many
Mm-hmm.
times, even for me in the beginning, having to gain that confidence. And so, Reverend Griffin, I I know you're going to tell us about why you got this vaccine, but how did you talk to your congregation about that trust and what we should do in terms of moving forward with getting the vaccine?
We at Antioch, yes. We the very first thing I did was this. I think the second week of the vaccine, I went and gathered all the information that I could about it, and just did a quick little flyer, a quick and dirty flyer and publisher about what the vaccine was, what you could do to prevent it, the things they were saying at that time, and I shared it with the community, with our church community, and we talked about it. We have a health ministry at our church, and Dr. Curtis Harris, who works part time for the state as well as an oncologist, he presented what the COVID virus was, how it impacted, and we talked about it, and we talked about it, and we talked about it. So for those 8 months that we were all in limbo, we kept talking about it. We have having health ministries, but our congregation was kind of set up to receive information, the scientific information. So when it came out that they first had a vaccine, what actually convinced me, first of all, was the fact that both Pfizer and Moderna, they didn't use any of the Trump money, the government money. They were privately developed, as far as I understood, and they had a high rate of efficacy, the 95, 93, 97%. Those numbers are floating around. So when that came out, it was easy to talk to our congregation about the efficacy of the vaccine and that we should move forward. We all had the hesitancy. We all had those conversations, but for our congregation, we had information that kind of helped counterbalance what was out there in the ether. And quite honestly, our congregation they kind of beat me to the punch, to be honest. When the vaccine came out, I was telling them about getting vaccinated, and they were like, "Pastor, we already got ours." And so for those who could get it, it was hard to get, but they did. They welcomed the vaccination, and they were ready to receive it. They overcame their hesitancy by having information from the very first week forward. And I think it's important that we continue to communicate that there is better information out there than what folks are receiving on some media outlets, and we have to keep putting good information out. And plus, I think the other piece that Reverend Page said it is, well, I felt it was the right thing to do for my family. I think it was the right thing to do for others. And as leaders, I believe that leaders lead, and you can't teach what you don't know, and you can't lead where you don't go. And so I believe that if we're going to, with whatever hesitancy I had to be overcome by the cost benefit analysis, not just for myself, but for my congregation and the families connected to my congregation.
Thank you so much. It's so very important to lead by example, because we can't preach to others if we're not walking that walk. And so, Reverend Waters, I know there's a lot of people in our community and our churches who still say, I'm just going to leave it to God. I'm going to just prayer,
Mm.
and I'm not going to do this vaccine. What is your answer to that, and how did you tell us about why you choose to get vaccinated?
Oh, well, yes, there are quite a few people who have said that they were going to leave it all into the hands of God. But because I am a people person and I like getting out with the community and being with others as well as my family. And so as the COVID began to hit within my family, and I could see my young niece struggling and hearing and not being able to be there with her um, to go through all of this, I was able to go out in the community and to let them know that we needed, as Black and Brown people, especially with the pre existing conditions that so many of us have. We know that we're not the healthiest people. We don't have time to go to the gyms, most of us. But again, I was able to go through the community and to talk about the COVID vaccine and to be able to help to eliminate some of the fear of not taking it because of all that we had gone through the year, from the White House, that people were very scarcely opposed of taking it. But as we talked about it and began to converse one with another and to open up that trust bond between us. And I went, I went to get my shot, and when I received the shot, and a few days later, I had no symptoms from the shot, and so I was able to tell most of the people that could sign up and go and get the shot because it was prevalent. Uh, because I needed to get the shot in order to be able to go out to be around others to not only protect my health because I am a cancer, both ovarian and breast cancer survivor, as well as I have asthma. So it is very important that I got the shot and continued on to be able to help others to understand and to be able to receive the shot. So I put my walking shoes on and began to go and knock on doors to people throughout the community to sign up and be able to help to get transportation for them to get the shot because it was important in order for us to be able to gather again that we all needed to be vaccinated. So that's how it all began. And a lot of them, did say at first, "I'm leaving it up to the hands of God." But I said, "Well, God has put man here to help to create things for us." And I believe that this Pfizer and the Moderna, the ones that I felt confident in, that was the way out for us to be able to obtain and to have the shot. So it was great. It was great. People received very easily and trusting and being able to overcome the fear. I went with some of them, took some of them, and we were able to get over 100 people throughout this community in Clarksville. We got them vaccinated. I don't think we missed anybody here on the street where I am. We all got in. So it was a blessing, yes, to do that.
Thank you so much. Thank you so much. And we know that as pastors, as reverends in the churches, and this is for you, Pastor Beeman, when we look at the deaths across the Delaware, over 82, 83% of those deaths occurred in our communities of over 65. And so for the elderly, which consists of a large proportion of our congregation in churches, that's the ones we worry about. And so tell us about why you chose to get vaccinated and how did you reach out to your congregation?
Well, first of all, I have a granddaughter. My wife and I have a granddaughter who has a compromised immune system. And so we became very aggressive about making sure that we kept our bubble tight here at 2 Collins Drive. And so we got tested regularly. I got tested every week. And then when the vaccine came out, that was a no-brainer. I was going to get that vaccine. I couldn't wait till it was my turn to get it. Also at Bethel, we created a Bethel COVID-19 task force. And that task force was very instrumental in the church being a site for testing. And as soon as the vaccine was available, we got over 100 plus of our seniors vaccinated. We want to keep COVID out of Bethel AME Church. And so that was basically the reason. And also, as I think Reverend Warden said, I firmly believe, and I read your book, Dr. Scantlebury, and as a transplant surgeon and other medical professionals, my wife is a medical professional. She's a nurse, plus she has a master's degree in public health. She deals with COVID-19 every day. She lives it and she walks it. And so I'm energized and encouraged by it. And I strongly believe that when the vaccines came out, not paying attention to Donald Trump, I was paying attention to the fact that God is a prayer answering God. And the Bible tells us that he gives the knowledge and the expertise and the ability to our medical professionals. I'm encouraged when I read your book that every time you did a transplant, you prayed and asked God to guide you. So I believe the scientists that were working on the vaccine were being led by God, because the Bible teaches that that kind of knowledge comes from God.
Amen.
Amen. Thank you so much. And to Reverend Livingston, tell us why you choose to get vaccinated and what were your words to your congregation?
Well, a few things. One is I have just recently retired from the senior pastor of Mother African Union Church as of September. But prior to that, I was very actively involved in getting information out to the congregation, very actively involved in getting information out to the community. Um, uh, by the time the vaccine rolled out, I was waiting for it. I was looking for it. I was expecting it. I was wanting it. I have a pre-existing condition and a compromised immune system as well. I have sarcoidosis, and so when they began to talk about people with pre-existing conditions being more susceptible to contracting the virus, that concerned me. But I, in fact, contracted the virus in October of last year. I contracted the virus, and I in fact passed it to my wife Frances. We know that because the first test that we took, I was positive and she was negative. And then a few days later, she took another test and she was positive. So we went through that. Thank God we didn't have to go into the hospital, but we did get sick, and we did go through experiencing the COVID-19 coronavirus. And so I know that it's real, and we prayed through it and talked through it. One of the things that I told the congregation, the scripture that we hung our hats on, was the 46th Psalm, first verse. It says that God is refuge and strength, a very present help in the time of trouble. And so one of the things that we have to do as people of faith is understand that God works in the miraculous. He works in the miraculous, but he also works in the natural. I heard Dr. Scantlebury talk about her journey and talk about praying before going into um, surgery, and talk about praying at various steps of the journey of her life as a surgeon. And I believe that the knowledge and the courage that a Dr. Scantlebury gets to be able to do what she did comes from God. And so when we tell people that God is a refuge and strength, a very present help in the time of trouble, yes, God can and does work in the miraculous, but God also works in the natural as well, in what He has already prepared. So by the time the vaccine rolled out, I was ready for it. Because of this pre-existing compromised immune system with sarcoidosis and high blood pressure and some other things as well. Plus, we experienced having it. Those people that say it's a hoax, that is not for real. As one who contracted the COVID-19 coronavirus, I want to tell you that it is real. Thank God we survived it, but it was extremely difficult for a moment. And so by the time it rolled out, Dr. Scantlebury, I was looking forward to it, and looking forward to waiting my turn and getting the vaccine.
So, despite getting contracting COVID, did you also get vaccinated?
Oh, absolutely.
Okay.
When the vaccine came out, I've got both my shots. I got vaccinated. The first opportunity to get the vaccine. My wife got the vaccine, and my mother got the vaccine as well. And so we were very excited about the possibility. Now we know about the Tuskegee experiment. We know about Henrietta Lacks. We know about all those ways in which African Americans have been used by the medical profession in this nation, sometimes to do not the right thing but the wrong thing. We understand that. We know that. We just kind of felt like this time, this is so out in the open, and the science told us that, first of all, this was a virus. People were dying every day. People dying every day in Delaware. I knew personally some of the early people that, when it was only 15 people had died. I knew about 2 of those persons who had died. One of my best friend's father, and who had been one of my baseball coaches when I was a child, and so I knew that it was real from the beginning, and that was very early on. That was in, I think, March or April of last year. So yes, Dr. Scantlebury, by the time the vaccine rolled out, I was more than ready to receive the vaccine, and did in fact
Well,
get
thank you.
both shots.
That's awesome. Most people are concerned about, well, I've had COVID. I don't think I want to get vaccinated. And so it is important to realize that even if you have COVID, not everyone is going to make antibodies against it. And so you may be the one that doesn't have antibodies after getting COVID. So it's important to get vaccinated. So Reverend Robinson, did you get vaccinated, and how was your side effects? Did you get both doses, and what side effects did you have?
Well, absolutely. I had both doses of Moderna, and the side effect from the first shot was a runny nose. And let me have a transparent few seconds. So, woke up runny nose, which I don't have. I don't experience that. Uh, with allergies or anything like that. And I must admit that I did get a little scared. I called my doctor in a panic and said, "Hey, why am I feeling like this? I have this runny nose. That doesn't happen to me, and it just won't stop." And so he calmed me down off the ledge and just reminded me and educated me a little about the side effects of the first dose. He said he actually had the same uh, side effect, and he told me, just get some tissue, keep it next to me, and I'll be all right. And he was right. The second dose I had it was about 32 days after the first, and side effect then was just feeling a little tired for about a day and a half, but bounced right back. I was fine, no other symptom. Uh, Arm a little sore, but that was it. So fortunately, that was it.
Great, great. So many people are afraid of the side effects. And Reverend Page, did you have any profound side effects from your vaccine?
Um, well, I wouldn't call them really profound or very serious. I didn't have any from the first vaccine. I had the Pfizer. This on the second vaccine. It was the day that we had one of our sessions, one of our community talk sessions, and I was very sleepy. I was sleepy for about 3 days, and if you remember that evening, I couldn't get Dr. Rebecca Walker correct when I was introducing her, and I think that was part of it. I just could not keep her information straight. And then that evening, I had chills. I went to bed with chills and then woke up with a very mild headache. But beyond that, I was fine. Every now and then, I still get a stinging feeling in my arm, not a hurting feeling, but just a sting where I had the shot. I think that was just to remind me that I had the shot. But that was about it. Other than that, I was
Great.
fine.
And Pastor Beeman, did you experience any significant side effects from your vaccination?
Zero. Thank you very much. Zero, none.
Great, wonderful. How about you, Reverend Waters?
Uh, from the first shot, I didn't have any side effects. From the second shot of the Pfizer, I was a little sluggish and I couldn't get my steps going as fast as I like to go, and I was somewhat tired, but I blamed it all off just me going, and it was time for me to rest. But other than that, but some of the people that went along that I got to go, in which I checked on every 100 and so people to make sure fine. Some of them had swelling arms, but other than that, I was good to go.
That's great. I know that I was expecting, significant symptoms with my second shot. I was with Dr. Coker, and we were thinking this all was going to happen, and we were disappointed. We thought maybe because we fall into that older group who don't experience as many symptoms. So, what about you, Reverend Griffin? Did you experience anything significant?
The first
Since
shot,
you're in
I
that
had the
younger
Pfizer.
population.
Younger, I don't know. I think, no. Thank you, though. I appreciate that. Wow. No, I had the Pfizer, and the first shot I slept for from Saturday evening, from Sunday evening to Monday evening. I just attribute to the fact that I just needed rest. I preached so hard, I just needed rest. The second shot, I had zero effects, zero side effects. It was just, I just went on my life as usual. So, no, that was it. But thank you for
Great,
the young.
great. No, no problem at all. And we know that we're still seeing people who are still not sure that they want to get this vaccine. Despite the fact that we are still seeing people being admitted to the hospital, we still see people who are dying. And there are those who still feel that despite all that is out there, the science, the data, that they're not going to get this vaccine, that perhaps maybe they will get COVID from this vaccine. Or maybe, as we heard before, I'm still listening to folks who say perhaps there's a chip that's being installed into our bodies because of this technology that they do not quite understand. So, what do you tell someone who is on the fence and not understanding the benefits of getting vaccinated? And I'm going to go back to you, Reverend Griffin.
Well, I would begin with, it's not just about you. The virus goes both ways. You can give it and you can get it. You don't want to catch it and you don't want to run the risk of getting sick. You don't want to run the risk of long haul COVID experience. You don't want to run the risk of paying the ultimate price, which is actually dying from the disease. But you can also give it, and that is you don't want to run the risk for those you love and for those who you care so much about, passing on to children, parents, siblings, friends. I would simply tell them, look, minimize the risk, maximize the return to a more familiar lifestyle. I don't think we're going to be wearing masks for a while, but we want to minimize the risks, but maximize the return to a more familiar lifestyle, and do that by getting the vaccine, get the shot, get the shot. That's what I would say.
Absolutely. That is so very important. And Reverend Robinson, we still see many young people who are anti-mask and feel like they are indispensable. Some of them live in intergenerational homes, realizing that they're putting others at risk. So, what advice do you give to these folks?
Dr. Scantleberry, I would say, if you love grandma, you love auntie and uncle, uh, take care of them. They are at home. They are trying to live in a bubble. You want to visit, they want to see you. Be responsible. If not for yourself, do it for them. Just like we want to make sure that our relatives are taken care of financially and their healthcare needs are met, make sure that you're not exposing them unknowingly to this virus. You know, take on that responsibility is what I would say to them.
And that's so true because there's so many who say, okay, I'm not afraid of COVID-19. It's not going to get me. So, Reverend Page, what do you say to those who are on the fence, and how do you get that message across?
Well, I'm dealing with that now because here, Reverend Robinson and I are out here trying to make sure that people are getting vaccinated. And I'm having a problem in my home trying to get, well, in her home, but my family trying to get my daughter to get her vaccine. And I said, look, you work for Child Protective Services. You're around people all the time. You don't know what they have. So you don't know what they're bringing to you or what you're bringing to them to protect each other. You really, to protect your own children, your household, that you really need to get a vaccine. And she sees it as poison going into her system. And I said, when you are sick and if the doctor prescribes medicine, you go and you get that medicine, you take it, you don't think anything about it, you trust that the doctor has made the best decision for you. And I said, always, pray about it. I was told to pray about it. And I tell people to pray about it and talk to their doctor, but to remember that we have to protect one another. And if you think about not being able to see your loved ones in the hospital when they get sick, when you think about the side effects of COVID, would you rather have the side effects than face death from COVID? Because and I let them know. I said I would rather have the side effects than to face death, but to always pray about it and really talk to your physician, but trust God and trust those who have developed the vaccine, because I tell them we see God in different ways, and that He is who equipped the researchers and the chemists to develop the vaccine. And they said, well, they came out with it too quick. No, I let them know what you said, Dr. Scantlebury, you and Dr. Coker, about the vaccine having been around for a long time. They've been researching it for a long time and just pretty much had to tweak it for COVID-19. And that's how they were able to come out with it.
Yeah, we have to thank a scientist from Philadelphia who has been working with
That's right.
mRNA for many years,
Yeah.
and her first paper was
Yes.
published in 1970 something. So it really has been around. The technology has been there, and we know that despite all that is out there, we still have those who have this reluctance and also afraid that this was something that was designed for Black and Brown people, and they're trying to knock us off. So, Pastor Beeman, how do you speak to your congregation and how you dismiss these myths that are out there?
Well, uh, agreeing with what a lot have already been said about the science and about taking care of ourselves. But when I got the vaccine, my first shot, I happened to go and pick up some food at one of our restaurants that talks about being friendly in the neighborhood. And young lady, she waited on me, and somehow we got to talking, and she told me, she says, I'm not taking that shot because it's been designed to kill Black and Latinos. And I said, well, and I listened to her. I really did. And I was trying to be empathetic. And then I looked her in the eyes and I said very slowly that at that time, we were moving close to 500,000 people who died from COVID. And I said to her, but I don't know one person who has died from the vaccine. And so we really need to see that the vaccine, and I preach and teach at Bethel, as the other pastors on the line are teaching and saying, that this is God's answer to our prayers. We're praying for something. And then when God provides it, we want to, dissect it in a way that is not helpful for Black and brown people. And so, and it's still true, even though after the Johnson and Johnson situation, those numbers are so low. Uh, People are not dying from the vaccination; they're dying from COVID, and so we need to get the vaccination.
Absolutely. And we know that it's not just brown, Black people. We know it's
That's
not
right.
just United States, it's across the
That's right.
world. Every country uh, just um, just about has been impacted with the deaths of so many. I think we're over millions of people who have died, and we still continue to struggle with those who are unsure about getting vaccinated and are still on the fence. And we need to reach herd immunity. In order to do that, we have to get at least 80% of the population vaccinated. And now, with hopefully approval coming forth in the next few weeks from Pfizer for younger age groups, as they're looking at emergency use authorization, we may be able to vaccinate kids before they go back to school, before they get out of school, and also for the summer, if it gets approved by the summertime. And so that's a step in the right direction. It's a step to be able to say these 12 to 15 to 16-year-olds can get vaccinated, but we also need the parents to be on board in order to bring those kids in to get vaccinated. And so we have a few minutes left. So I'm going to just go to each and every one of you and say, ask, you can tell us what you would like to tell folks out there about COVID-19 and the vaccination process. And I'm going to go back to you, Reverend Livingston.
Okay, well, thank you. I just want to encourage people to get the vaccine. I mean, there's so much. There are things that we don't know about COVID-19, and therefore maybe even don't know about the vaccine. But there are some things we do know. We know that over 500,000 people have died from the COVID-19 coronavirus. We know that people can transfer it unknowingly. We know that the elderly die more so than than younger people. We know that most of the people who have died are elderly, so we want to protect our elders. But we also know that it's so random that it doesn't. There's no determination about who's going to die and who's not going to die when they contract the virus. But we know that it's random, so that means anyone who gets it. So we want to take as many precautions as we can based on what we do know. We do know some things. We know that 500,000 people have died. We know that the elderly died. We want to protect them. We know that it's random. We know all those things. So let's take as many precautions as we can.
Absolutely. And for many of you that are out there, you cannot get COVID from the vaccine. That's important to know. This vaccine is made from mRNA, both Pfizer and Moderna. It's delivered into your body. It causes you to make those antibodies or those fighting proteins against the spike protein. And we know that there are so many variants that are out there. We know right now the UK variant, the South African variant, they're both here in the United States. And we know that they're double mutants, that are coming together to be more virulent and more aggressive and easily transmitted amongst each other. So we still need to take those precautions. We still need to wear a mask. We still need to social distance. And I know there are those who want to get back to church. And Pastor Beeman, you are well aware of, each and every one of you, those older folks who are dying to come back and to mingle and to embrace each other, but we still have to be cautious. And so in the last 10 minutes, just in 2 minutes each, just give me your parting words of what you want to say to those who are listening. And so I'll go back to start with Reverend Waters. I think she may be frozen. Okay, so Reverend Page.
Okay. To please get the vaccine. Um, you, and after you get the vaccine, continue to get tested, because even though you get the vaccine, you can still contract COVID, but it won't be as serious as if you had not had a vaccine. So, please wear your mask. Please socially distance, and encourage others as well to get the vaccine.
Thank you so much. And remember, as Reverend Page said, the vaccine doesn't keep you from getting COVID. It's 100% keeps you from dying of COVID or being hospitalized 85%, 95%. So you want to develop antibodies. You don't know if you can still be a carrier or not. And we know that there are many different variants that are coming down the pipeline. And so we're going to go to Reverend Griffin. Final words.
Yes. I want to read something that I wrote. It won't be. I'll be within a minute, I believe, or at least a minute and a half. First of all, I think getting vaccinated is an act of love, not just for yourself, but for others, because I believe that eventually we're a community of families. And our church's lay mission statement can be paraphrased to say that we were created to live not as man over man, but as persons, brothers and sisters, living, loving, trusting, and working together. We're family. That means that no matter how we normally act, when trouble comes, when true crises arise, we step up, stand up, and show up and defeat our common foe because we're family. It's not an I thing or me thing. It's a us, it's a we thing. Get your vaccination, not just for yourself, but for all those you love. Show them you love them and that you care for them. Get your vaccination. And as Reverend Page said, continue to get tested to make sure that you and those around you continue to live healthy, full lives.
Awesome. Thank you so much. And Reverend Robinson.
All right, I will conclude with what any good AME does, and that is give 3 points. One, live with care. Secondly, don't be pressured to let your COVID-19 precaution guard down. And lastly, take care of others.
Much. And Reverend Livingston.
Yes, I thank you. I would just want to reiterate to take precautions, as so many have talked about. Continue to wear your mask. Continue to act wisely. Continue to even as we look into the future. I'm one who likes to work out. I don't think I'll ever work out again without my mask. Um, so let's continue to take precautions. Let's continue to do some things that will protect ourselves and protect others as well.
Thank you so much.
And get the
and
vaccine.
Reverend, get the vaccine. Absolutely. Reverend Pastor Beeman.
What I would say is, and then say, and we'll say it over and over and over again, that we need to trust God through the science. If we look back and think how we have, through vaccination and through science, through medical technology, nearly eradicated polio off the face of the earth. How through science, we have been able to, and vaccinations, deal with the numerous flu pandemics that have affected the world. And so I would say to people, we've been praying, we've been trusting God, We have heard, if my people are called by my name, humble themselves and pray, seek my face, turn from their wicked ways, then will I hear from heaven, forgive their sins and heal the land. And God is doing that. And he's doing it through the aegis and the brilliance of the medical community that has shown in the past, in spite of what we learned about the Tuskegee experiment and so forth, that there is a level of trust that we can take upon God, that he has answered our prayers. And those prayers being answered was God moving in the scientific community to make sure that we got this done. Get the vaccination. Trust God through the science.
Absolutely. We got to trust him every day in everything we do. And I see Pastor Waters, you're back. We're wrapping up. Any final thoughts before we go? Can you hear us?
Yes, I'm sorry. Thanking God for all of the time to be able to speak with this panel and to know that we have to continue to listen to what the science is saying and be able to speak it to the people to help them to understand that it is important that they get the vaccine, even though, they feel that it's this, that, or the other, but to try and to get them to understand that it's important that it will be a preventative for you if you are vulnerable to the COVID-19. It will help to prevent some of the effects of it, as well as you are protecting other people, as you go out. And we do want to be able to get together and to enjoy our lives as normal as we can, of seeing one another. So I just say let's continue to press on to our people. We're a little slow, but we will catch on. We do catch on, and it just takes persistency to continue to get them to understand that that is what we need to do in order to get beyond this disease. Because God is with us, and if He's for us, what can be against us? Nothing. Amen.
You are
Amen.
so right. You are so right. And we know that with Moderna and Pfizer, no one has died from the vaccination, from getting the
Right.
vaccine, but thousands have died from COVID. And if you don't die, you run the risk of being a long hauler, progressive symptoms, not getting back to normal. And so it's not just about you, it's about your community, it's about the people you live with. And if we are going to get back to some semblance of uh, even beginning to go about our business in a semi-normal way. I don't know we'll ever be normal again, but it's going to take each and every one of us to do our part, get vaccinated, because our lives depend on it, the lives of our neighbors, the lives of our families. That's so very important. So it's not just about you, it's about everyone who is around you and those people you love. So get vaccinated, and I thank each and every one of you for being here today on this wonderful webinar, joining us. And those of you in the audience, if you have more questions about our concerns about getting vaccinated, talk to your pastors, talk to your reverends and the faith leaders, so that they can have a very frank discussion with you about your fears and hopefully get you to be on the other side of the fence and get vaccinated. Thank you so much, everyone. Have a wonderful
Thank
evening
you.
and hope to see you
Thank
again.
Thank
you.
you.
Thank
Thank
you.
you.
God bless
Take
you.
care.